So where would she be getting them from? But I sent the urine for the tox screen anyway. And what came back was genistein. What is genistein? Genistein is a plant estrogen. It's plant estrogen. And that was what was driving her breast development.
Where does that come from?
So I asked the mom, I said, you've already told me about her diet. What do you bathe her in? And she looked at it. She was on the phone at home. And she said, well, I use this Victoria's Secret bath gel. And I said, what are the ingredients? And then she looked at it. She says, not for use in children. And the reason is because the reason it's Victoria's Secret bath gel is because it's loaded with plant estrogens to make your skin silky smooth. So this kid was absorbing the estrogen through her skin from her bath. Got it?
Her mom was inadvertently giving her a sex hormone
Yeah.
therapy.
Yeah. Without knowing it. So environmental estrogen, okay, can also be an environmental obesogen because after all, estrogen lays down subcutaneous fat. As an example. All right. Parabens, things that are in cosmetics like lipstick, okay, and hair care products. The list.
It's basically
Tributyltin.
I'm not going to say everything, but lots and lots of things.
Tributyltin is what they use to paint the bottoms of boats to keep the barnacles from attaching to the hull. Okay, so all our water supply is filled with tributyltin. And my colleague, Dr. Bruce Blumberg at University of California, Irvine, has shown that this particular compound is so egregious and also has epigenetic effects going forward. So you can expose an animal to tributyltin and their great, great, great grandchild will be obese because of what you did to the great great grandmother.
If we're using it on boats, is it in the tap water?
Yeah, it's in the tap water,
and we're in the tap water at levels that should concern us. Yeah.
Yes, absolutely. So you're never going to get away from these PFAS. Polyfluorinated alkylated substances. The whole Teflon thing. If anybody wants to watch the movie Dark Waters, came out in 2019 with Mark Ruffalo. It's all about DuPont and how they hid the Teflon story from from the populace for 20 years. Okay, this is and these are forever chemicals. They are not going away. Another example, DDT. So DDT is a plant. Is an insect estrogen. Okay, it is an insecticide. Okay, it's what we sprayed on all of the crops during World War II, to basically get rid of the, insects, malaria, and what have you. Okay. But turns out DDT is an estrogen, two hydroxyl groups, 22 estrogens apart. That's why it was a good insecticide. It was basically a contraceptive, for the insects. But we can measure DDE levels in pregnant women's urine today, and it predicts obesity in the child at age 5. Okay. It's been gone for 50 years, but we can still measure it.
So, given everything that you're telling us, the question is simply going to be, how does an ordinary person react to learning all of these things? And, I can think of a number of reactions, but none of them seems particularly palatable. Reaction one could just be you become Ted Kaczynski and you move to a shack in Montana and try to destroy civilization. Let's assume we don't want to go down that path. Reaction two could just be to say, fuck it. Like, whatever. I don't care. I'm just going to, this is what we live in. And that's basically what people do.
Yep.
Reaction three could be to just become completely neurotic about all this stuff and, become, an uber health nut, for lack of a better term. Most people probably aren't willing to do that. Don't want to have the anxiety and the stress that come with that as well. Is there another path? What is the path?
Yeah. So, Nick, you're absolutely right. And you've identified 3 of the 4 paths. There's a 4th. Okay. So no question, we've got people who, are lunatics, in part because of, what society has wrought upon them. We have the people who have basically chosen to ignore it because it's just too hard. That's a lot, most of the population, I would say. We have orthorectics, who basically now, question every single thing they put in their mouth and, are dysfunctional because of it. It basically feeds into OCD, to make them very miserable. Or there's a fourth, which is actually do something about it. Okay. Number one, vote. This is a voting issue. This whole obesity thing, the whole food thing, the whole environment thing is a voting issue. Now, a lot of people think that there are other reasons to vote, but this is one of them. And you should actually, want to do something about this. Another is explain this to your doctor, because your doctor doesn't understand any of this, and they need to. And the reason is because doctors went to medical school to learn two things, the two P's, prescriptions and procedures. And I know because I'm one and that's what I learned. There's a third P, prevention. Does doctors learn prevention? Not currently. Mm-hmm. And why is that? Because 80% of the medical school costs are underwritten by Big Pharma.
Mm-hmm. So I'm going to put this in a way that isn't going to seem like defeatist. So let's take those in reverse order.